Speeding up diagnosis would be great if we could, and that's in terms of access to disease-specific therapies. And so that might be, we know that this medication is important to avoid in this disease, or we know that this type of therapy might be really useful for children with this issue. Earlier diagnosis also tends to give access to clinical trials. For a lot of these conditions, late diagnosis means that you're actually losing brain cells. And so it's vital to try and have as early a diagnosis as you possibly can.
It's really important to provide children and families with an understanding and an answer as to what is going on with their children when they have issues. From a clinical perspective, it's very important for us to be able to identify diseases, particularly those where we have a tractable therapeutic option, but indeed also for those where therapies and supportive measures can be implemented for that child to improve their life. Perhaps less well appreciated, childhood dementias affect not only the child in question, but families. It's tragic, but not uncommon for those of us that deal with these conditions to meet a child and make a diagnosis only to turn around and find out that the parents have other children who are also affected by that same disorder, but may not necessarily be evident at that point in time, or indeed are pregnant, or indeed are looking to add to their family and try and minimise the distress of having further children with that condition. So early diagnosis is important in that regard as well.
After giving a diagnosis, families do want to know what the next steps are. I have to really listen to the families as to how much they want to discuss at what time point, but giving that message that the door is open is very important. I would think the next steps are also communicating the diagnosis to the broader medical team. So that could be GPs, paediatricians and therapists as well. So getting their permission to share the information, and also giving them links to resources and family groups that can provide more information. They may need physical therapy, occupational therapy to assist with mobility and pain. They may need services to assist with feeding and nutrition, so dietitian and speech pathology. That can also help with communication. They may need supports and services to assist with vision and also behaviour. And I think talking with families, this is one of the most challenging symptoms, is behaviour and sleep. So I think finding a professional in the community that can provide support with behaviour management and support with sleep is really important. So a lot of the care is not just about looking after the child's symptoms, but making sure that carers are supported and that they're looking after their own health and getting the emotional support that they need to remain well. And I think it really comes down to palliative care as well. And palliative care is not about doing nothing or end-of-life care. It's about managing symptoms to have the best quality of life. So introducing the role of a palliative care team for symptom control and care in the community is really important. Families will find it confronting, but if it's framed in the right way, they can benefit a lot from that care and support.
As a professional, if you feel uncomfortable with that discussion, and, who can blame you, then, discussing early with the palliative care team, you can lean on some friends in your local palliative care team and say, look, this is the situation, this is the family, and have that discussion with the palliative care team early. And remember, it's a process. It's not a one-off thing.
Unfortunately, there's only a small group in this current contemporary medical setting, only a small group of those disorders that have a tractable therapy. However, that's changing, and there are increasingly therapeutic trials of new technologies pharmaceuticals and genetic therapies for these conditions. And what we know from these conditions is that there is typically a window of opportunity to provide a meaningful benefit to patients with these disorders.
And so it's important that families know about that option and are provided with links on how to search for clinical trials. I think I would always tell families that they are welcome to come and discuss specific clinical trials with their healthcare team to really make decisions that align with what is right for their wishes and the care for their child.